Diabetic Ketoacidosis by Tristan Barrios, Chelsea Bojorquez, Elizabeth Artiga, and Nina Suega. In this PowerPoint, you will see the situation and background of the patient, morning assessment, recommendation/plan, religious considerations, lab considerations, nursing considerations, and pharmacology, specifically gabapentin. Mr. Lopez is a 78-year-old Hispanic male who is recovering in the orthopedic unit of the hospital from a right total knee replacement 2 days ago. Mr. Lopez has type 2 diabetes and was diagnosed with the condition at 35 years old. He has been managing his illness with blood glucose checks when he feels different. He is currently taking Humulin R on a sliding scale based on his glucose results. He weighs 315 pounds and has developed osteoarthritis in both knees, requiring surgical replacement of the knee joint on the right side. At 8:15 this morning, Mr. Lopez was lying in bed awake. His mental status was altered and there was a fruity odor to his breath. Vital signs were 100 beats per minute for heart rate, respirations of 32, blood pressure of 116/78. His last blood glucose level was 156 the previous night before bed, and he received 2 units of insulin at that time. However, he did not receive his morning glucose check or any insulin today. The rapid bedside glucose check revealed a blood glucose level of 468. The physician is contacted, and upon further examination, Mr. Lopez was diagnosed with diabetic ketoacidosis, to be referred to as DKA for the rest of this PowerPoint. The plan for Mr. Lopez is to administer 0.9 sodium chloride IV at 500 milliliters per hour per physician orders. The nurse is to start a drip of regular insulin at 0.1 milligrams per kilograms per hour. The physician has also added orders for lab work, including a metabolic profile and ABGs. The current results were a sodium level of 135, potassium of 3.2, chloride of 95, and calcium of 8.5. The ABGs resulted in a pH of 7.31, a PCO2 of 20, a PO2 of 95, and a bicarb of 12. An hour after his plan of care began, the insulin was started. The nurse checked Mr. Lopez's blood glucose level and noted it had decreased to 208. He appears to be more comfortable, and his vital signs are a heart rate of 92, respiration of 22, blood pressure of 116/70, O2 saturation of 95%, and is on 2 liters of oxygen. Further analysis of his ABGs reveal acidic pH, which can be a result of excess ketones formation related to insufficient insulin needs. A pH of 7.31 is acidic. HCO3 of 12 indicates metabolic acidosis. A PCO2 of 20 indicates respiratory alkalosis. So let's talk about hyperkalemia for a little bit. Hyperkalemia can be caused by insulin deficiency, hypertonicity, and acidemia. Extracellular potassium shifts. The potassium ions move to the blood plasma and in between cells. It is typically seen prior to treatment. Hypokalemia, possibly seen, caused by the kidney's compensation mechanism. The kidneys normally reabsorb glucose. However, due to the abnormally high levels during DKA, it is excreted, leading to osmotic diuresis. It can also be caused by treatment, such as IV insulin. The potassium ions in the intravascular fluid, aka bloodstream, move into the intracellular fluid, aka cells, leading to a decrease in potassium blood serum levels. Here is a picture to illustrate what was just talked about. The nursing diagnosis for Mr. Lopez is risk for fluid volume deficit related to hyperglycemia-induced osmotic diuresis, as evidenced by polyuria, polydipsia, and blurred vision. The first desired outcome is the client will remain normovolemic as evidenced by urinary output greater than 30 milliliters per hour, normal skin turgor, and good capillary refill throughout the shift. The first intervention to achieve this is to assess the skin turgor, thirst, and mucous membranes to provide baseline data for further assessment every 4 hours. The second intervention is to monitor intake and output to assess for normovolemia every 4 hours. The third intervention is to assess neurological status in order to assess for blood volume depletion every 2 hours. The second desired outcome for this patient is to restore fluid/electrolyte balance and acid-base balance, as evidenced by normal lab values, normal blood pressure, and blood glucose levels between 70 to 200 throughout shift. The first intervention to achieve this is to monitor blood glucose levels to assess if DKA is improving throughout shift. The second intervention is to monitor ABGs to assess if DKA is improving throughout shift. The third intervention is to monitor blood pressure, especially orthostatic hypotension, due to decreased blood volume from dehydration throughout the shift. Nursing considerations. In order to provide patient-centered care, it is important to assess for and carry out orders to treat hyperglycemia through IV regular insulin, electrolyte imbalances, low circulating blood volume by restoring with blood products, and dehydration by giving IV fluids. It is also important to monitor cardiac due to abnormal potassium levels. It is also important to monitor blood glucose levels and ABGs. It is important to take religion into consideration with all patients. The nurse should speak with the wife in order to assess what religious preferences are in order to make appropriate referrals. The patient is most likely Catholic, and in Catholic religion, sacrament of the sick by a priest is important, as well as the belief that suffering is a punishment from God. While the nurse is not familiar with the sacrament of the sick and other Catholic beliefs, the nurse can delegate these responsibilities to the appropriate person in order to respect the patient and patient family beliefs. In rituals of Catholic religion, lighting candles and using rosaries to aid in prayer is common practice, so the nurse should allow this. Now let's talk about gabapentin. Gabapentin is an anticonvulsant. It affects chemicals and nerves in the body that are involved in the cause of seizures and nerve pain. Common side effects of gabapentin include confusion, depression, dizziness, drowsiness, and ataxia. Patient education. Take as prescribed. Store at room temperature and away from light and moisture. Do not stop abruptly. Do not double up on doses if one is missed. Contact your physician immediately if you experience weakness or shortness of breath, blue-colored skin, lips, fingies or toes, confusion or extreme drowsiness, imbalanced coordination or problems with muscle movement. Here are the references used in order to create this lovely presentation. Thank you for tuning in.